So welcome to the next episode of Beyond the Couch, which is coming live from the Irish Hypnotherapy Conference. Got it right, yes! And I have Carina McEvoy here, and she is a specialist working with children. Now, a lot of people say you can't use hypnosis with children, but you can, and Carina's going to explain how. So a little bit of a background about yourself and how you work with children.
Great, thank you. Thank you very much. Well, hello, my name is Carina and this is my colleague Frankie, and we've been working with children since 2018, haven't we? Yeah, absolutely. And we got into it because I myself was quite an anxious child, anxious teen, and I know what it's like, so I just love the idea of being able to help other children and teenagers who are feeling that way. And you know what, when you're working with a child, you are constantly working with the subconscious because, as you know yourself, the children's mind will go in and out of subconscious all the time. So when I'm working with young children, Frankie is my colleague, and it's really Frankie that works with the children and not so much me, because he's able to connect with them so well, and he's able to be their voice for something that they feel like they can't share or it's too silly to share. They will put the problem onto Frankie and they will talk about Frankie's problem, and then we're able to solve your problem, aren't we, Frankie? Yeah, absolutely. But you know, it's wonderful to work with children because in this day and age, like, with life being so busy all the time, and we are constantly in a rush, there is smartphones all the time, we are losing our ability to be bored, we're losing our ability to wait. I don't see that I'm working so much with trauma as a learned anxiety and a learned idea that we can't just cope with the pace of life. And children that come in to me just feel like they can't cope with whatever situation it is. So a lot of what we actually do is psychoeducation around what anxiety actually is and how they can deal with it and how they can cope with it. And I feel that behind every issue, whether it's bedwetting or fear of flying or separation anxiety, you do have the idea that you can't cope, so there is anxiety behind it all. So that's a lot of what we work with, and you know what, children really need people to work with them. Children really need you as a therapist to work with them, and when you work with a child, you're working with the future inner child. So it's wonderful to know that you're getting that child before they even become the inner child.
So what sort of ages do you work with?
So I would work with, say, 4-year-olds up to early adulthood. But even before the age of 4, if the child cannot work with me themselves, I will work through the parent. And I will give the parent the skills to go and work with the child at home. Because really, when you're working with a child, you're working with the parent. You know. So
obviously it's not hypnotherapy in the standard sense that people know. Sit on the couch, taking a deep breath, relax, close your eyes, and you don't take them on a journey. So it's a waking hypnosis.
It is
non-trance hypnosis.
So when I trained in hypnotherapy, it was your formal hypnotherapy. You're using your inductions, your regression to cause, your scripts. But when children come in, the whole process is different because children process feelings so differently. They process through movement, through creativity, imagination, playing. That's how they process it. So I use a lot of conversational hypnosis, and they are, when you are playing with a child or when you're doing Lego or whatever it is, you have that focused attention in and out. And when you know you have the focused attention, that's when their resistance is down and the suggestibility is very high. So you can get in with your suggestions then. So a lot of metaphors. So it's conversational hypnosis, and it's very flexible. You have to be very flexible. You have to be. There's no such thing as a script. It is knowing knowing the child really well, knowing what their interests are, and coming into their world and using their world and their imagination to solve their issue.
Well, I mean, that's the important thing is, as children, we learn through play. We learn our role in life, our position in life, our status, all through play. So you start with the peekaboo, which is the separation. Then it goes on to playing like role-playing games, like cowboys and Indians, cops and robbers, doctors and nurses, and then playing house. And just learning. So we learn our roles in life through play.
We do.
So play is so massively important.
It is.
And it looks like he's going to bite me.
I know, he's looking at you. He's looking at you. He's a little bit, sussing you out a bit.
So I think a lot of people are fearful with working with children because in the traditional hypnotherapy sense, people don't want their child put into a trance. They don't want someone to meddle around with their brain.
No.
So how do you break down those barriers with the parents to start with?
Well, yeah, you're working with, when you have a child as a client, you're working with the child, but you're also working with the parent, the family, and you're working with the developmental stage of the child and the legal framework. So I will always have the parent come in first, have a parental session first, and talk about what I'm going to do and how I'm going to do it. And that really, it is, there's absolutely nothing scary about it whatsoever. But one of the biggest things for hypnotherapists is the legal framework, and that there isn't really much put in place for hypnotherapists. And I feel that it would be lovely to have a tighter framework legality-wise around it, but confidentially, when you're working with a child, it's not the same as when you're working with an adult. You cannot guarantee, because you're always looking at the welfare of the child. Are they safe and all of that? It can be a very uncertain area to work in, but really when you delve into it and you know the legalities of your country, of what you need to have for your country, and you have that framework in place, then you can just settle into it with confidence.
And do you see the parent and the child at the same time, or do you see the child separately?
It really depends. It really, really depends. It's such an easygoing therapy. So you might have a child that wants mommy and daddy there, and sometimes that's actually really good because you're working with the parent as well, remember? And they're learning techniques together. But sometimes you can be guided by the sense that child is not going to open up without the parent. Mm-hmm. So it's a really kind of, you're judged by your own intuition, I suppose, that you feel. Yeah.
Play it by ear.
You play it by ear a lot, yeah.
So anyone who wants to learn, because still I don't think I would work with a child. Give me that adult that's about to explode.
And I wouldn't work with adults.
So if people want to learn more about working with children, do you offer training for that?
I do. I've actually just recently put together a training model. So it's the CVC model for working with children and teenagers. Yes, and it is going to be, it's an 8-week course, it's online, and it gives you everything that you need, comprehensive guide and training to work with children and adolescents. Here comes John with a little flyer.
And just as we say that, coming into view will be your flyer. Let's get in touch with you.
That was magical.
As if by magic, one hit me.
Wow.
So, do you want to hold on to
magical. Yeah.
So that's brilliant. So I will put the contact details. So any therapist, and remember, you're not working just with the child, you're working with the future generations.
That's it.
So working with the family, working with the child, but you're working with the future. Mm-hmm. And as John said on his little speech yesterday, it's the ripple effect.
Oh, it is. I like that.
Yeah, it is. And watch out for that podcast, because I'm going to grab him tomorrow and record him. We're going to talk about the ripple effect, because 300 hypnotherapists in a room, and I think he blew everybody's mind with it. Absolutely did.
He's amazing.
So thank you very much for the time.
Thank you.
I will put the links up. I'm going to take a nice photograph of that and put it up as well. And thank you for watching.
Great.
And see you all next time.
Bye.
Bye. Oh, don't forget to hit that subscribe button down below for the next content. Bye.
Bye.